bubbles.
Good morning. We do need a chair. We need to get you on the table. Okay, so we're here.
Oh, it's live right now?
It's live. I do this all the time. We're officially live. So we have Jess here. I tell you, we have way too much fun. Let us know if you can hear us, if you can see us.
Yeah, let me know if this works.
Do all the things. Hi, Sabrina. So this morning we're struggling, but I feel like that's just our lives. Right now, Jess, she's not in a hospital bed, in fact. She's in a very comfortable recliner. We're here with Diana at St. John's Sport and Spine Chiropractic. They have this amazing chiropractic office with so many additional treatments and all this good stuff. So we are going to kind of share a little bit right now. Diana, you're going to share about the laser.
Yeah.
Right?
Hi, guys.
Here's Diana. If you don't know Diana, she's absolutely fabulous. We're going to share all these things, but tell us, sit here for right now.
Okay.
Come sit in the hot seat. Yes, I'm going to sit.
Just sit right there.
Here we are. So here we are. Okay, Diana, how did you guys, because this is a family-owned business, right? So it's you and your husband. Is this some sort of joke to you? We are presenting a small business in a professional manner, and I got a foot in my face. So tell us a little bit about your journey. So you
guys learn different things about the body and how it works, and chiropractic is just awesome overall. There's so many other avenues that you can take with chiropractic that most people don't know. Most people think, oh, you're just going to get, your neck cracked and then that's it. But Chase really focuses on, I can't look at you. Chase focuses on the body as a whole. So if there's a problem with your neck, well, what's causing that issue? It's not just the bones. There's muscles that are causing a lot of that. Or is there something going on emotionally, immune wise? So there's a lot of factors that come into the body other than just the bones. So that's kind of what our approach is. We're active approach. Functionality is our big thing. So yeah. And then we have.
And you treat all ages.
All ages.
Yeah.
We do treat all ages. Our main focus is, we mostly see between age 9 and up. Mm-hmm. But we have seen babies. Our babies are fully adjusted all the time. So yeah, if somebody has any issues, you can always DM me. I love to help people. So if there's ever a time you're like, hey, I have a question about this. I'm not sure if this is the right route. Even if it's something we can't do to help you, we are so closely knit with the community, and we have so many other doctors that are amazing that we know.
And that's one thing that I really loved about y'all's practice is, thank you. Excuse me. So one thing that I really loved was when I came here, she's like, okay, if we can't figure it out, or because I was like, I want my kids adjusted. They're big into sports, all these things. And Jess is still here. If you're just joining, let me show you. Jess, in fact, is here.
I'm very relaxed.
She has her own mini mic, right? She's very.
Yes, I do.
She does. She has her own mini mic. We just can't all fit in the video. One day we'll get real video equipment. Until then, yes, we have to. So it was really neat because I was saying like, oh, well, what happens if the XYZ? She's like, oh, we have a network of people that we work with. You're not just like, oh, hey, I want your money, so I'm going to adjust you even though I don't really know if I can fix your problem. They refer out, and like she said, they've built this community, and they're all about collaboration, and that's a big reason why we're here today is because we were like, hey, one, we've used your services. We love you guys. We're aligned with your mission and your vision and serving the bigger purpose. And so we're like, let's go in, let's do this, and show us all of the things. So we're going to get started because we have quite a few different things. I'm trying. There's a foot. I don't know if you guys can see the foot. Yeah, back it up. So let's talk about this because this is really probably what people are wondering.
Great. It's very tight compression along your legs, but it feels so good. So Diana, you need to get in it and tell us about it. You can, sit right here if you like.
I kind of feel
We're extremely
here we go.
In between her legs. Okay.
We're very close friends, all of us. You're not yet.
Yes. That's one of the things I absolutely love about this group is they're just real, amazing women that just want to support each other. So if you're contemplating like, should I be a partner? Should I do this? Yes, 100%.
Yes, you'll never escape.
Yeah. Then you'll never be able to get out.
I really do think we should gift everyone the mini mic. I take it so seriously when you have a mini mic.
I know.
Okay, yes.
So these are compression sleeves. We do have it for your legs, your hips, your arms. A lot of times people will use this for that quick recovery. So let's say you do a marathon or you're really big into sports and you're training a lot and you have to recover quick, these are wonderful. It almost has like a lymphatic drainage effect to it. So it's recouping that blood, trying to regenerate all that blood flow in your legs or wherever you're getting it done. We've noticed a lot of our patients that have a full schedule with sports, whenever they get this done, they're able to train a lot harder and a lot quicker. So this is just a great tool to be able to recover.
And I'd like to add, I have a lot of swelling in my feet and in my ankles because I have arthritis, and this actually helps a lot with the swelling tremendously. The swelling goes down. It's not as puffy, or like there's not as much inflammation around my ankles when I do this. How
long do you recommend sitting?
Everyone's so different, and that's another thing that we do. We're customized based off what the patient needs. So somebody that's been training really hard, probably about 20 minutes is a great place to be at. If there's someone that is more like a maintenance thing, sometimes we've had people in here and they're just like 10 to 15 minutes just to be able to have that lymphatic drainage to help with the inflammation.
And can kids do this as well?
I would say any child that is into sports or active, for sure. I don't know if they would be able to fit. We've had some pretty small kids in here too, but yeah, kids can definitely do it if they need it.
Yeah,
right?
I'm just thinking of poor my Emmett, my 11-year-old with his constant IT ban and saying how
that's great for that. So definitely, if you're into sports and your kid is active, this is awesome for that recovery. If they have any kind of tightness, injury, or inflammation on the legs, arms, a lot of baseball players absolutely love this. Like the pitchers, they'll go on with their big old it's great. Or hips, ladies, when you have menstrual cramps. And you have a lot of
weeks ago, I was dragging,
a lot of hip issues. That's wonderful for the hips and releasing all that tension.
Okay, I love that. So these are definitely. This is just one of the many. So now on to the laser. What does the laser do?
So laser,
the laser does a lot.
It's wonderful. So we don't even have to turn on. So the laser is a class 4 laser. Sorry, I'm right up in her booty.
Again, we're all friends here
with the mini mics. So the laser is a class 4. There's multiple levels of laser. A lot of people know red light therapy. That's at a basic level. That's superficial. It does feel great. It helps with the relief in the muscles. But class 4 is so not intense. It goes so deep into the cellular level. So it's bursting energy to your mitochondria. This is crazy.
Oh, wow.
I know. You think about it.
I'm going to pause. I love her passion. So you would think, I'm going to see Dr. Diana. You actually see her husband, who is just as knowledgeable, just as fantastic. But when I speak to her, I'm like, you are passionate about what you do, and your knowledge level goes beyond just like, being, running the office or running that. So yes, continue mitochondria.
It goes into your mitochondria and bursts the energy into the cell. So you're just getting all this energy into that cellular level. So it's recovering a lot quicker. Just like if you're having a cut on your arm, everything like the blood, everything goes to that area to try to heal. That's what we're just doing with that laser. We're bringing all the blood, all the energy to that area so that it can heal a lot quicker. We've had people walk in where they literally cannot stand, in so much pain. And we've done 3 sessions of laser and they're able to walk out like normal. What? So it's done so many great things for our patients. That's why I stand by it. And everyone's different. So you might come in and you're like, I don't feel too different, but I do feel a little relief versus the other patients like, oh my gosh, it just changed my life.
Yeah,
yes. So we try to focus on what technologies are going to help our patients recover quicker, heal quicker, with no need of injections or pain management. We will refer if there's any point they're like, oh my gosh, it's awful, I can't manage it. We know great pain management docs, but before you get to that point, we don't ever want anyone to get surgery. So these are wonderful tools to get to that point before you get to that.
In which I honestly, I wish I knew Diana and Dr. Chase before I had shoulder surgery, because I had the shoulder surgery and I know at that point I needed it, but I didn't know there was nothing. I mean, I was going to a chiropractor and he was helping and not saying anything negative, but there wasn't the next level of hey, actually the knowledge and the passion that you have, and everybody's different. Everybody thinks I'm not saying anything bad, but I did get surgery and now I'm like, I hate the fact I needed it. It definitely feels better. I couldn't lift my arm, but now hearing these practices, and it's like, oh man, I wish I could have at least tried just one more thing rather than cortisone shots into surgery.
And even if you get surgery, like there's a lot of patients that, especially mini Mike, especially patients that are athletes. We've had patients that have had ACL tears, had to have surgery. They come in and they get something like this done, and it just quickens the healing. Yeah,
that's right. Because I still have some parts in it, and I had this shoulder surgery a year and a half ago. I'm still cautious. It feels 1,000 times better, but I get nervous, and I'm like, because I can still feel little tiny twinges, and I'm like, and I've done one treatment of this, but I was not consistent, so I need to.
Well, and even at that point, we've had an athlete that's come in, and this poor kid, he's young, he plays sports continuously, and we have a wonderful PT here. If you guys ever need a PT, movement driven, shout out to you guys. And he's the one that actually recommended his patient to come in and get laser shockwave, because it just brings you to that next level. We've had people say that even when you get incisions, C-sections, I had a C-section, it was awful. Scar tissue builds up and creates pain. People don't realize the amount of pain that you can have from scar tissue.
My shoulder, because it's literally on the point. Look right here. See this point? That's when I'm like, I'm literally like, ow, I'm always massaging on that point.
So scar tissue builds up. It creates so many issues. And when you have that scar tissue, nothing breaks it down other than if you have like a scraping or manual therapy. So what the shockwave done, which is when we do the walkthrough, we'll show you, it breaks down that scar tissue, and then the laser comes in and heals it. So even
the shockwaves was a bump, that was cool.
That crazy machine that makes a lot of noise. But we do have a lot of patients that have had C-sections that need that scar tissue. The shockwave's too much, so we just do laser, and it still does the same kind of healing, and the process is awesome, and it feels great. So there's so many things, so many fun things.
Okay. Yeah. So with that being said, how long are you stuck in these boots for? What are we gonna? Because you can stay. We can do a little walk.
She's actually.
I will say that I have been bringing my kids here, and we've gone to chiropractor care for years since they were babies, and this is their favorite, hands down. Aww. The other offices, they did not want to go. They'd give me a hard time about going, but when I tell them we're coming here, they get really excited. So they like this the best. And I had really bad low back pain a few weeks ago, and Dr. Chase helped me with stretches and did adjustment, and they checked on me, and I was all better soon. So it was great.
Cool. And I mean, I've never seen her ever, because she's like the queen of wellness, right? So she's always got all these things, and she's like, no, I literally like,
it was bad.
Something's wrong. And so we showed up here. That was that day we showed up here with all of the children. Sorry. But no, it was pretty cool to see that transition.
Yeah, now when the kids when they come back, they expect all the children to be here too.
They're like, is this a play date place? Like, and they're so gracious. They're so good with kids. Because I'll tell you, you take her out of the boots. So I was really, I have 4 boys. If you don't know, they're 13, 11, 8, 5, well-mannered, but obviously they're boys and they can be rambunctious. And they have this gym area, which we will show you, that's just really warm, inviting, welcoming to anybody. So the kids were like, I want to touch things. I want to try things. And Diana was like, no, I'll show them. Like, look, this is for this. This is for this. And it was just warm. Like, I felt like coming in here, not like, don't touch that. Sit down. Don't do this. Because as a mom, I don't need any more stressors, and I understand there's certain places, don't touch, don't do, but I want to have generally places that I feel comfortable bringing my kids, and I loved it here. Okay, so let me pin this while we walk. Oh no, we're gonna go walk. Let me put that on. Okay, I'm gonna disconnect from this.
I'm missing a shoe.
You don't need a shoe. Oh, there it is.
Thanks.
Okay, so I'm gonna turn this around. I'll hold it and we'll walk. Oh, like you're facing you. Oh, here, you take the mic. Oh. You get the mini mic. I just can't get over the mini.
This room that we're in is actually where our massage happens. So we do have the Normatech suites here, but we also have 2 massage rooms.
So here's a massage room here.
We have Lisa
nice, dark, quiet.
So they do
beautiful fireplace.
Different types of massages, but they both have a great.
It's normally not this messy. We did throw stuff everywhere, so just disregard. It's actually very neat and clean here.
So we're actually going to come this way. Back there, we do have the PT, Dr. Greg. Follow him, movement driven, awesome guy. And then we do have 2 treatment rooms.
So treatment room 1.
In here,
treatment room 2.
We have our shockwave, which is the machine that Jack was talking about. Do some research, guys. Radio pressure wave, that's what it's called, the actual terminology for it. I always tell patients, please look into it. Mayo Clinic uses it. They use the laser and the shockwave, and so it's just a great machine to use. You'll see it a lot in podiatry offices too. They do it for neuropathy and arthritis, and plantar fasciitis. And then over here we do have our table that does do an automatic decompression on lower back.
And that's the assistant right there. She's a great assistant.
That's how you know, like, you're a family-owned business. So when people say, "Oh, can I bring my kid?" Of course. You know, we don't expect anyone to leave their kids out. They'll have something to do. They have snacks too.
They have snacks, yes.
Over here we do have our decompression table. This is something that has changed a lot of people's lives. I honestly will say that because people that have herniations on their discs or have nerve pain, this table does wonders. It helps decompress that spine and open everything up to bring back that nerve and the sensation in your nerve. And then over here we do have cupping and scraping. Chase loves doing that on patients. So if you ever need a cupping session, we got you.
Literally. I love that. We got your back. Literally. Look at you. You're so punny.
So over here we have our gym.
Look at this.
This is where we do a lot of the rehab.
And this is Mickey's schedule, right?
Yes. So Mickey. Fitness. Another shout out.
Missy's fabulous. I said Missy because I combined Mickey and Mace. Okay.
She does do her workout, so she'll put it up here. So she uses this space for workouts and stretching. So we have a physical therapist, a personal trainer, and a massage therapist here. They all use this space. Chase will do rehab out here.
And this is actually, note, that wellness, we were talking about doing like a wellness fair and getting some people in. So this is where, yes, that's coming soon.
We have our front space. And then over here we have Dr. Chase.
Yep, this is Dr.
Chase. Here's a mini mic.
I know, it's just what we work with. Dr. Chase, how are you today?
Good, how are you?
Very good. So do you want to tell us what's your top 3 things you're most passionate about for chiropractic? I know there's a lot, so you're on the spot.
Yeah.
Watching people improve, just their pain, helping them get better, seeing them be able to move better and just function better, like throughout, just every day.
Like Melissa, where did she go?
She's
Oh, she already left.
Bring your mini.
Sneaky
You gotta bring your mini mic up. We have a
just
mini
seeing
mic.
them do. Oh, a little closer. Sorry.
I don't think you hold it like that, but it's very entertaining to watch on this side.
Seeing people just be able to do things that they love again, that they weren't able to do before,
Yeah.
obviously is the biggest thing.
I love that.
Yeah.
As far as, like, your
Favorite.
what do we say, like cupping and adjusting
Modality
give me
and
the terms.
treatment.
What's your favorite treatment to do?
I would say being able to see people suffer a little bit in the gym.
Yeah. Right there. So if you don't know,
Yep.
I love
Yes.
that. That's very cool.
Yeah.
Oh, yeah.
He does love the rehab part of things. It's honestly, functional movement is our favorite thing. We love seeing people being able to move again and do what they like and their passions again. So when he gets them out in the gym, he's like super nerdy. He gets excited about it. So, and any questions you have, like, he's ready to do the research and look into it. So that's why I'm so passionate about it.
I walk in here and I love the Christian music,
Oh.
the gospel music. I'm like,
Yeah.
it's just
Yeah.
very,
We do, and sometimes you'll hear gospel, sometimes you're gonna hear 90s because I'm a 90s baby, so it just depends.
real life.
Yeah,
Yeah.
exactly.
Real life.
We try to have it be warm and welcoming and
Yeah.
and comfortable. So
Yes, and you're always gonna see someone in the front. Right now we have Victoria in the
Hi,
front.
Victoria.
So and we have some CBD oils. We have these CBD oils are a little different. They do have a little THC in it, so they help in a different kind of level.
And these are package options, right?
Yeah,
Okay.
yeah. So we do have package options. We take insurance. So we try to be fairly flexible. So yeah. And if you need prayer, we do have a prayer box over there. So
Look at, this is literally
our little coffee. Yes.
You want people to move in here?
Pretty much. I told Chase, I'm like, all we need is a shower, guys. All we need is a shower in the back.
Shower. You won't get rid of it.
Yeah, there we go.
Right?
There we go.
I
So
love
yeah. That's pretty much
anything else
it.
that you guys want to get together? Go behind.
I
Go
know,
right
I
there,
feel
actually.
like.
No, go right here.
Oh,
This looks really
okay.
pretty. Look, okay, this wall.
Yeah.
Just fine.
No, you're
So
fine.
one, this wall. This wall. And actually, let's get the wall you guys can see.
You can come up here.
Yes, okay.
And wait, we have our daughter.
Oh, she was under.
And it's funny because she dyed. It's her birthday, so she gets to dye her hair. She gets to dye her hair once a year, and so she dyed it blue, which works. Anyway,
I kind of love this.
yeah,
We need a picture here after too.
yeah.
Okay. Any final words? Anything you want to share? Any like specials you're offering? Whatever you want to say.
What do you think?
No pressure though.
Oh,
I know I'm the talker. I'm giving him the option to
cannot
talk.
think on this. Cannot think on this.
I would say if you guys have any kind of pain, anything that you need help with, whether it is back related or other like arms, legs, we do everything. So if you need any kind of help with that, we're here for you. Even if it's not with us, we would love to help answer any questions you might have. We do have packages. We have options for insurance. So feel free to DM me for any questions.
Is that the easiest way to DM you, or would you rather have them call, or what?
I would say if it's a specific question you have, just DM me. Yeah, just DM me for sure, because I will answer you much quicker. If you call, we get like so many calls throughout the day, it might get lost.
Special treatment as BFFs, we get to DM you.
Yes, you get to DM me. As BFF, you get to DM me. Yes.
This person, whoever wants to talk to them, not a BFF, they can't DM
They
you.
can't DM me.
Are you BFF?
Exactly.
Yes. Then I'm sorry. Call this number. Yeah.
Okay, let me turn this around. Then we'll get all in it. All right, here. We're still here. She's out of the boots just in case. Oh, mini mics. So we just want to say thank you guys for taking the time out. So thank you.
Thank you.
I love that. This is great. So yeah, if you have questions, comments, concerns, all the things, this is going to be up on YouTube, on the website. Go share it with your friends, guys. Just get more eyes on local businesses. Do your due diligence. This is how we serve. This is how we grow. This is how we lift people up. Jess, any final words on the mini mic?
No, have a happy weekend.
Have a happy weekend. All right, bye guys.